Good evening, everyone. It's Jen Freiheit with the Kenosha County Division of Health. Hope you are able to get out today and enjoy a little bit of sun after the several rainy days and lift the spirits up a little bit with the sunshine. The events of the past week were, needless to say, deflating and tragic, but public health will keep doing what we do best, and that is protecting the health of the public using all of the tools that we have in our public health toolbox. We are here to save lives, and we do a really good job of that in Kenosha County. This virus is not over. It doesn't care what side of the political fence one falls on. It does not care that we're close to a border of another state, and it's here, and it will be here for a while. So we will still continue to fight this battle. And to ensure that the public understands through our communication what we need to do to minimize risk and to save lives. We have recently just put up on the Kenosha County COVID Hub website the gating criteria that you might have remembered hearing about with the Badger Bounce Back Plan. And the Badger Bounce Back Plan had last week stated that the state was meeting 5 of the 6 gating criteria, and it is up on the state's website. But we run the numbers for Kenosha County, and Kenosha County is still only meeting 2 of the 6 gating criteria. So we will keep this information updated on the County Hub website. Every other day, we will be updating the data and the numbers, so anyone can go out there and keep up with where we are as far as the gating criteria in the original Badger Bounce Back Plan. We have not moved into a long-term recovery phase. In fact, technically, we're not really even in phase 1 of the Badger Bounce Back Plan because we have not met all 6 of those gating criteria. But the spigot has been opened and economy is coming back. So we have moved into more of a harm reduction phase. We are at 921 positives right now, 21 deaths. And these are not linked or related in any way. We received questions about that. And our hospitalizations remain fairly low. We only have 12 hospitalizations right now. So I would love to be proven wrong, and I hope indeed that we are as we watch some of the states that opened several weeks ago who have not seen quite a spike. So we're hoping that we are proven wrong in public health, but we're going to continue in the meantime to use our data and the best science we have. And public health will be prepared for the worst, hoping for the best, but prepared for the worst so that we can still mitigate this virus and try to contain this pandemic. You may remember 2 months ago when we started these conversations, the health department had determined 2 critical missions in order to fight this pandemic. And the first critical mission was really around education. We wanted to make sure that the health department was doing all that we could to educate our businesses, to educate our schools, to educate our families and individuals, our residents of Kenosha County. And to that extent, this past week has been filled with educating businesses. We are finding that the businesses are amazing in seeking what is a best practice, what are recommendations they can do to make sure that they open safely for both their workforce and their staff and for the customers that they serve. So we do have the Kenosha County Kickstart plan that will be finalized at the end of this week. And that plan is really giving some details to businesses as we continue to work with hundreds of businesses through various meetings with CABA and a task force that has been formed and working through reviewing people's websites and their plans and offering best practice guidance from a public health perspective. So that has really been the focus of the past week. There will also continue to be communication. There will be statewide marketing and messaging campaigns. The communication for this is not over. Just because the Safer at Home is no longer in place does not mean that we end our communication. In public health, we laugh that we continue education until we're tired of repeating ourselves, but that's when people finally maybe hear it. So we will continue the communication and making sure that people know how to protect themselves and are safe from this virus as we open up our economy. Our other critical mission with the health department, aside from education, was containment and utilizing all the various containment measures that we have at our disposal to continue to contain this virus. Two of the most important containment measures we have at our disposal is testing. And I am happy to report that over the last month, we are close to tripling our testing rate per every 1,000 population. We are averaging still about 85 tests a day. However, with the new drive-through testing site with Kroger Health and Pick and Save, in 2 days, they have already tested over 372 people. We are very excited because this now puts us at our threshold at 257 tests per day with Kenosha County, and we hope to continue to sustain this through a whole host of measures. We still want businesses who are experiencing an outbreak or have concerns to look into testing as well. The governor put out 2 weeks ago that there was a high interest to get all congregate care settings, long-term care facilities tested, and we now have 6 of 9 skilled nursing facilities that are testing all residents and all staff. And we're looking forward to continuing what is the long game plan for testing. I do want to just let people know we're receiving numerous phone calls at the health department about test results. The labs typically take 48 to 72 hours to get test results back to us. So it's not an expedient process, but it certainly is much faster than it was at the beginning of this response when it was taking 5 to 7 days to get test results back. So please be patient. We will call you as soon as we have a positive test result, and we will be investigating those positives. And we'll continue to request the National Guard to come into Kenosha County to help us with testing various facilities that have outbreaks, and the health department stands ready to help businesses that do want to look into testing that way. We're hoping that sometime at some point in the near future, we will be able to move beyond just testing long-term care facilities, that will be able to help businesses set up accounts and receive testing and get those sort of testing protocols in place. Another piece of the containment mission is contact tracing. We continue to provide 100% contact tracing to every positive case that we get. And we're also looking at ramping up our workforce. Today we trained about 12 volunteers to help us with contact tracing. We're also filling some vacancy positions in the health department, so we're very excited to ramp up our workforce to prepare for any potential increase in the curve. We have distributed 561 thermometers throughout Kenosha County and 2,126 masks, both cloth and surgical masks, throughout Kenosha County. This is not something the health department had to do. We do this as a door drop to help ensure that people can monitor their own symptoms at home, be protected when they have to go out. And so this has been a free service that we've been able to provide for anybody who has tested positive and needs a thermometer and needs a mask that does not already have one. This week, we have also worked with our Board of Health. We do have a county Board of Health that is an advisory board to the health department, and we are certainly working on increased messaging through our Board of Health. We are also looking at our continuity of operations plan and our continuity of government plan. When this all began, we had to look to that COOP-COG plan, as it is called, to basically pare back all of our health department functions. Restaurant inspections weren't going on, home visiting wasn't going on, so that we could put all hands on deck for responding to COVID. But there are still many things that are happening that public health cannot ignore. We have we're seeing a higher rate of overdoses in Kenosha County, increases in domestic violence and suicide attempts. We certainly still see that our and underinsured population is not getting access to the care that they need. We still have high rates of chlamydia and gonorrhea in Kenosha County, so we're looking to bring back some of those continuity of operation functions that we had to put on pause for a little while because we want to increase our sexually transmitted infection testing and contraceptions and providing the care and access that our populations need. We want to ensure that we help workplaces put in policies as well, sick leave policies that their employees know about so that employees do not feel pressured to come to work if they are sick for fear of losing their job, that they will be able to stay home, keep the virus contained. And these are some of the things we're working on this week as far as the issues of note that we are concerned about this week. I did receive one question about antibody testing. The question was asked, is this part of our plan, our overall plan? And most certainly, we are looking at the long-range plan for antibody testing when it becomes more viable. Right now, the country is just not there. There are many research studies and trials that are happening right now, and that will include parts of Kenosha County coming up in the near future. And we want to make sure that there's a high degree of confidence, a low degree of false positives or false negatives with these tests, but that will become part of our long-range plan. And even beyond that will be the vaccination plan and how we incorporate COVID vaccination, whether that be through our annual vaccinations for children and for families, or if it becomes part of the annual flu immunization programs. So we do have plans to incorporate antibody and vaccination when those become viable and when those become available. At this point, they just aren't there. We did also have a question, or maybe more of a request, that we discuss proper use of masks. And this question has come a lot. We see people on TV who are wearing masks just over their mouths. Proper wearing of a mask covers both the nose and the mouth, pinched tightly over the nose, so that it basically creates a small seal, if you will, around the nose and the mouth. And we do encourage that people continue to wear masks when they're out in public. It is not only a safety measure for self, but it's a safety measure to prevent the spread amongst those around us. And so we do like to see that business places and people frequenting those business places are all wearing masks in order to help the greater good. Containing this virus will take everyone. It is not just a government function. It takes all of us in order to contain this virus, box it in, so that we can get quicker to phase 2 and to be able to open up more. So it does take all of us to help open up the economy to help contain this virus, including the social distancing, the good hand washing, staying home when sick. All of those sorts of things are needed in order to keep that from the spread from happening. I'm going to look quickly to see if I had any other questions. And I do see that we have no new questions at this time. So I do want to just remind everyone the virus is still here. Just because the economy has opened does not mean that we are over this by any stretch of the imagination. Like I said earlier, we have not moved into long-term recovery phase, as we call it in emergency management. But we do want to reduce harm, and we do need everybody's help in protecting all of our residents, all of us in Kenosha County. And I did just receive one other question as far as what do the businesses, what would happen if there's a positive in a business? So I do want to just walk you through that process really quick. Is that if we get through our Wisconsin Electronic Disease Surveillance System a positive case, we immediately call them and we start doing an investigation. And that investigation basically asks, when were they sick? What symptoms do they have? Who lives in their household, and are any of those people sick? And where do they work, and where have they been? We then, after doing that investigation and doing a high degree of education, telling them what isolation and quarantine means, telling them what they need to do to protect their families, and sometimes these disease investigation calls can take 1 to 4 hours, especially if we use a language line or there's language barriers there. It can take quite a process to go through this investigation of a person and all of the members of their household. But then we pass it off to our contact investigation team. And the contact investigation team is the one who is contacting the workplace or the business and basically asking, basically saying, we have a positive case that worked in your facility last Friday. Can you please give us all the names of the people who were on shift last Friday between 12 and noon or whatever the time frame was? We collect those names, and then the health department starts calling down. We do not give the name out of the positive case, but we will go down through those lists and we will say, you may have been in contact with a positive person, or you were in contact with a positive person. We ask them if they have any signs and symptoms, and we basically then instruct them as far as what quarantine means and what they can do to protect themselves. So that is how we sort of box in the virus, by placing people who are sick or people who have been exposed on quarantine, and ensuring that they stay home, monitoring their temperature, monitoring their signs and symptoms until they have passed the 14-day quarantine. So it is a way to keep businesses open. It is a way to for HR departments or small businesses to work with the health department in order to ensure that we don't have people continuously coming to work and reinfecting others, that we can contain this as best we can. And that's also in line with our education, as working with the businesses and what can we do to help minimize the spread within a workforce of a business. So that is how we work with businesses, both through getting contact tracing lists, helping with the messaging if they want to message to their staff or to their families or to their customers. We can certainly help with that. And then helping with any other good public health methods to prevent the spread within their business. So we've had really great success. Businesses have been very compliant and working with us and ensuring that they're sharing their information to help contain this as much as possible. So that is how we work with businesses when a positive does come through. So I thank you very much again. The partnerships and the collaborations in Kenosha County have been amazing. How much people have understood public health practice and have employed that within their businesses, and we continue to look forward to creating more partnerships and helping out in any way that we can. Thank you, and go out and enjoy the rest of the evening.